Hold up your hands and look closely at your fingernails right now. I'm Dr. Deepins. What if I told you that a simple change in the shape of your fingertips could be an early warning sign? In fact, up to 35% of lung cancer cases present with a very specific, visible change at the ends of the fingers. Before we explore the science, we are going to perform a quick self-diagnostic test together. It's called the Shamroth Window Test. Bring your hands up to eye level. Now, press the top knuckles of your two index fingers together, nail to nail. Look right at the cuticles. Do you see a tiny diamond-shaped window of light shining through? If you see that little diamond of light, that is perfectly normal. It means the angle of your nail bed is healthy. But if your nails lie completely flat against each other and there is no gap at all, you may have what we call digital clubbing. Now, if you don't see the diamond, take a deep breath. Do not panic. It is a sign to investigate, not a diagnosis. So, what exactly is digital clubbing? It is a physical change in the nails and the soft tissue at the ends of your fingers. The nail bed softens, and the angle between the cuticle and the nail increases. The tips of the fingers may bulge out, looking like upside-down spoons. It is typically completely painless. Because it happens so gradually over months or years, many patients never even notice it. Why does a lung issue show up in your hands? The answer lies in your cardiovascular system and cellular biology. Certain lung tumors produce specific chemicals, primarily a protein called vascular endothelial growth factor, or VEGF. VEGF tells your body to build more blood vessels. The tumor uses this to feed itself, but these chemicals circulate throughout your entire body. When these chemicals reach the furthest points of your circulation, your fingertips, they cause the tiny blood vessels to dilate and the soft tissue to overgrow. This isn't a new discovery. Hippocrates first documented finger clubbing in patients over 2,000 years ago. It's vital to know that lung cancer is not the only cause. Clubbing can also result from congenital heart defects, liver disease, or inflammatory bowel issues. However, when clubbing appears in adults later in life, lung cancer and chronic lung diseases are the most common culprits. Let me share a story from my clinic. Mr. Davis, a 62-year-old avid gardener, came in for a routine checkup. He casually mentioned that he was having trouble gripping his gardening shears because his fingernails had started curving around the tips of his fingers. He had no cough. He had no pain. But because of his age and smoking history, I immediately ordered a low-dose CT scan of his chest. We found an early-stage tumor in his right lung. Because we caught it early, purely due to the shape of his nails, his treatment was highly successful. Clubbing is what we call a paraneoplastic syndrome. But there are other hidden signs of lung issues that often get ignored. Another major red flag is unexplained shoulder or arm pain. Many patients think they just slept wrong or pulled a muscle. But a specific type of lung cancer, called a Pancoast tumor, grows at the very top of the lung, right next to the nerves that feed the arm. If you have shoulder pain that radiates down your arm, doesn't improve with rest, and is accompanied by weakness in your hand, don't ignore it. Sometimes this nerve compression causes Horner's syndrome, a drooping eyelid, a smaller pupil, and a lack of sweating on one side of the face. A third hidden sign is a sudden persistent change in your voice. If you sound hoarse or raspy for more than 3 weeks, pay attention. The nerve that controls your vocal cords loops down into your chest cavity. A tumor pressing on this nerve can paralyze a vocal cord. I know this information can be frightening, but knowledge is power. Recognizing these signs early is the key to longevity. While we must look for hidden signs, we cannot forget the classic red flags that require immediate medical attention. A new persistent cough that doesn't go away after 2 to 3 weeks, or a chronic smoker's cough that changes in sound or frequency. Coughing up blood or rust-colored sputum, even a tiny amount, should never be ignored. It warrants an immediate scan. Unexplained shortness of breath during daily activities, like walking up a single flight of stairs, is a sign your lung capacity is compromised. And finally, unexplained weight loss. Losing 10 pounds or more without changing your diet or exercise routine is a universal red flag. Now, let's bust a dangerous myth. I never smoked, so I can't get lung cancer. That is entirely false. While smoking is the leading cause, up to 20% of people who die from lung cancer every year have never smoked. The leading cause in non-smokers is radon gas, an invisible, odorless, radioactive gas that seeps into homes through the foundation. If you haven't tested your home for radon, buy a simple hardware store kit this week. it is a completely preventable risk. Other risks include prolonged exposure to secondhand smoke, occupational chemicals like asbestos, and severe air pollution. Genetics also play a role. If a direct family member was diagnosed, especially at a young age, your risk is elevated. So, what should you do if you notice clubbing, or if you fall into a high-risk category? You need the right screening. A standard chest X-ray is often not enough to catch early tumors. The gold standard is a low-dose computed tomography scan, or LDCT. An LDCT scan takes multiple detailed cross-sectional images of your lungs, allowing radiologists to spot nodules when they are as small as a grain of rice. If you are between the ages of 50 and 80, have a 20-pack year smoking history, and currently smoke or quit within 15 years, you qualify. Medicare and most private insurances cover this yearly scan for eligible adults. It is quick, painless, and saves lives every single day. Let's build your action plan. If you did the Shamroth window test today and didn't see the diamond, do not wait. First, take clear photographs of your nails today from the side and the top to establish a baseline for your doctor. Call your primary care provider. Tell them explicitly, I am experiencing digital clubbing and I would like a pulmonary evaluation. Be your own advocate. Write down any other symptoms, even if they seem unrelated, like mild shoulder pain or a slightly raspy voice. Let's recap what we learned. Finger clubbing is a painless bulging of the fingertips that eliminates the diamond gap. It's caused by chemicals like VEGF increasing blood flow to the extremities, often driven by underlying lung issues. And remember, a persistent cough, unexplained shoulder pain, or voice changes require immediate medical imaging. Your body is incredibly intelligent. It uses signs like nail clubbing to communicate with you. When it speaks, listen to it. Thank you for watching. Share this video with your loved ones. It might just save a life. Subscribe for more health insights. I'm Dr. Deepins. Keep moving, stay vigilant, and take care of your body. Goodbye for now.